I'm joined by Dr. Marie Gwinn, an optometrist with Community Health and Dental Care. Thank you so much for joining us, Dr. Gwinn.
Thank you for having me.
All right, so the word optometry implies measurement. Is that the essence of what you do?
Yes, and more. There are definitely a lot of measurements involved in what we do, a lot of data collection, but then there's interpreting that data to discover the underlying problem. And then there's the clinical problem solving involved in solving that underlying problem. And we really use that clinical problem solving to create a treatment plan very specific to the patient. So the measurements are just step one.
Just step one of many steps. Other than measuring people's vision in order to prescribe glasses or contacts, what conditions can an optometrist detect?
Oh, wow. An eye exam tells us so much about a patient's health, anywhere from detecting a brain tumor or a stroke to systemic disease like high blood pressure and diabetes. And actually diabetes deserves quite a bit of focus here because not only is it becoming more prevalent, but the eye is the only place that we can see blood vessels without a more invasive procedure. So when we do a dilated eye exam, we're seeing the retinal blood vessels, which are some of the smallest blood vessels we have in the eyes. And whatever's going on in those blood vessels is a good indicator of what's going on in the vessels in the rest of the body. So that's why primary care physicians and endocrinologists put such emphasis on patients with diabetes having their annual diabetic eye exam.
Well, let's talk about that. You know, how often do you recommend people getting an exam, even if they don't have glasses, especially children?
Yes. So I agree with the guidelines set by the American Optometric Association. The first eye exam should be performed between 6 and 12 months of age. I know that's surprising to a lot of people, but it's incredible what information we can gather at that age. And important information. There's something called a retinal blastoma, which is a childhood cancer that starts in the retina. And so very important to start early, but it's never too late. If you didn't have your child examined before age 1, just do it now. And then after age 1, age 3, age 5, which is when we start seeing patients at CHDC, and then every year after that.
I just think it's incredible that there's so much more when you think of optometry. You know, I got to go to get my eye exam for my glasses or my contacts, but to think that they can see diabetes.
Yes, yes. And glaucoma is one as well that can be tricky because glaucoma is a disease of the optic nerve where patients start to lose peripheral vision. But if it's not being treated properly, that can encroach into central vision loss. And glaucoma is painless and it's very slowly progressive. So patients don't maybe not realize it's happening until that vision loss is severe. But if they had their annual eye exam, we would pick up on it, we would start to monitor and treat it and hopefully prevent that severe vision loss.
All right, thank you, Dr. Gwinn, for joining us.
Thank you so much for having me.